All right, we are back now. We're time for our Ask the Doc segment with Dr. Levine, and thank you so much for being here. A few minutes later than normal, but
no problem.
We had pressing issues down in
the show.
South Texas. Exactly. Thank you. Well, bring up kind of a personal situation. I'm sure people are kind of wondering why I had like a sore on my lip. Well, the deal was I had to have a little surgery to get a precancerous ulcer, or whatever it was called. I'm not very good at listening about things like that.
Sure.
But I think the important thing is, especially this time of year, is to remember correctly that, to always protect your lips and put whatever you need to put on, sunscreen or whatever it is. Do you find that to be kind of, is that becoming an issue now, you think, with so much sun exposure for people?
Well, I mean, I think we talk about it all the time because there's been a lot of excessive sun exposure with a lot of people, and skin cancer has been on the rise, and it's nice to know that we're talking about it more and getting the awareness out there that sun can affect you in a lot of different areas. You mentioned that you're an avid bike rider, and that's probably where you got most of your sun exposure, and a lot of bike riders are not thinking about their face or their lips when they're riding, but obviously a lot of sun hitting the face, and in patients who are susceptible, then yeah, you might need to have some good sun exposure or some sun protectant, that is, when you're out there for 2-3 hours, as most bike rides can take, and it's normally at 2 or 3 o'clock in the day, which is a high point of the day, and we ask patients to try and avoid those days, but certainly if you have certain hobbies, golfing would be another hobby that puts you out in the sun. You need to protect your lips. It is a part of your skin system. The skin is actually the biggest organ of our body. It protects us in a lot of different ways, and so sun is a major issue in terms of damaging the skin. As we know, there are some societal pressures for patients to tan and look a certain way, but it just damages the skin, and the best way is to limit your exposure as much as possible by using protectants on the lip, sprays, oils, big hats, shirts, etc. The main thing is to try not to get exposed, but again, if you have hobbies, if you're on vacation, etc., then certainly just get as much on your skin as possible, as frequently as possible. If you're sweating a lot, certainly keep applying over and over again. There's never enough protection, as far as I'm concerned, when it comes to protecting your skin from skin cancer.
Yeah, stitches were not fun. Let's get to a question real quick if we can. When does menopause start? This is from Janet. I went from 6 blankets or down to 1. And she's 36 years old.
I mean, it is still pretty young. I probably would do some metabolic evaluation with some blood work, see if she's diabetic, if she has any thyroid issues. Normally, menopause, which is cessation of menstrual periods, normally starts in the late 40s, early 50s. It's normally very welcome by females. It's not something you have to mess with. But a lot of times they have other issues, as this viewer is mentioning, about night sweats, mood swings, constipation, also weight gain, all sorts of physical symptoms that a lot of the ladies just can't tolerate. They don't like it. It's a huge shift. A lot of times we can't put them on hormone replacement therapy to alleviate those symptoms.
Okay, Dr. Levine will be here when we come back from break to answer more of your questions, so stay with us. All right, let's get back to more of your questions. Ask the Doc with Dr. Levine.
Yeah.
Jacqueline writes in, I had a spinal fusion in L4-S1 3 years ago. Lately, my lower back has been hurting more than it did before the fusion. Is there something wrong with the hardware holding everything in place?
I don't think so. You can always get back with the surgeon who performed the surgery. They can do updated x-rays to determine if any of the hardware has moved. Typically not. A lot of times patients will have chronic arthritic changes of the back that the surgeons did not operate on that remain, and so those issues can worsen over time. So it's probably just a progression of the disease that was there 3 or 4 years ago. It doesn't mean that the first surgery is a failure. Typically not. That normally happens within the first several months or so. But just get back with the surgeon, do some updated x-rays just to make sure, probably just a progression of the chronic illness.
All right. 62-year-old woman says she has severe stomach pain. Is that colon issues?
It certainly could be. There's a lot in the abdominal cavity. It's basically a bucket, holds a lot of our internal organs. So it could be a number of things. Could be the pancreas, the kidneys. If she has not had a hysterectomy, it could be ovaries. A plethora of things. Certainly we have to include colonoscopies, CAT scans, blood tests, physical examinations, multiple consultants. It can be very challenging to figure out what is causing a person's abdominal pain. Could just be a simple constipation issue, but certainly we have to evaluate all that before we can come to that conclusion.
All right, 53-year-old woman says sharp pain in her left side. What is it?
Left side, normally we think of constipation, can do that as well. Kidney issues, again, same sort of deal where we have to do a extensive evaluation, try and figure that out. Musculoskeletal diseases such as lumbar, spine, DJD, we talk about that a lot on this show, can sometimes radiate around to the front and cause lower abdominal pain. Abdominal pain is nothing you want to mess with. If you have it, you'll get it evaluated. There are certainly patients who, after that thorough evaluation, we don't know. We just don't know what it is, and a lot of times we just have to place them on medications, try and soothe the pain, and certainly keep following them and doing repeated evaluations depending on their symptoms.
So get a check. 72-year-old woman says she has memory loss. Could that be Alzheimer's or just memory loss?
Well, absolutely. I think at 72, we're always concerned about that, and so certainly get to your healthcare professional, get an evaluation, which can include lab work, X-rays such as an MRI or a CAT scan of your brain, and maybe a trial of some medication such as Aricept or Namenda. That is a big issue at 72. Our chances of developing Alzheimer's dementia increase as we get older, so certainly you want to get on the medicines as fast as possible. They work the best the sooner you start the medication.
And last question, 36-year-old woman says she gets up and she feels dizzy. I think a lot of us do that.
Yeah, absolutely.
Seems like that's kind of common.
Such a broad symptom. Certainly if it's just when she gets up and it's for a few seconds, doesn't sound like a whole lot. But certainly, if you're concerned, get into your healthcare professional and get it checked out.
Absolutely. Doctor, thank you very much for being here.
Absolutely.
Appreciate
My
it.
pleasure. Yes, ma'am.
You make
Yes,
our
sir.
Mondays really good. Thank you so much.